Thank you for the opportunity to present today. My name is Shannon Thyne. I'm a pediatrician at Olive View UCLA Medical Center, where I see patients in primary care and for sick visits. I also serve as the DHS Director of Pediatrics. In this role, I have the opportunity to help our workforce support children across DHS through expanding access to services, focusing on health equity and quality improvement, and implementing programs such as ACES LA, the program I will discuss today. ACES LA has been in existence for nearly 5 years. It is a partnership between community programs, DHS clinics, the One Degree online referral platform, and more than 500 partner community-based organizations. The program is LA's implementation of a state program, the ACES Aware Initiative, which is focused on preventing, screening for, and responding to adverse childhood experiences, or ACEs. The state provides $29 for each screening on top of managed care payments. These payments have the potential to strengthen our workforce by supporting trainings, new personnel, and better community connections. Before I share the details of our program, I want to give a little background on adversity, toxic stress, and how they impact health. Adverse childhood experiences, or ACEs for short, are stressful or traumatic experiences that occur before the age of 18. The 10 original questions covered the categories you see on this slide. These include abuse, neglect, and household challenges. Over the past 20 years, a robust body of science has emerged that shows us how our biography becomes our biology. We now know that childhood adversity can lead to poor health outcomes. Starting in the first bubble, a high dose of cumulative adversity during early life without safe, stable, and nurturing relationships to buffer stress can lead to a toxic stress response. For example, it's good to raise your heart rate and blood pressure before a big test or when running away from a bear in the woods. But it's not good to raise your heart rate and blood pressure every single day when you have repeated exposure to a chaotic home environment in a violent neighborhood. When this happens, the positive stress response turns into a toxic stress response. And we now know that this can disrupt multiple body systems, including brain development and our immune and hormonal systems. These changes together are termed the toxic stress response. And while we have always understood that adversity impacts mental health conditions, we now know that high ACE scores are associated with increased risks for 9 of the 10 leading causes of death in the US, including heart disease, cancer, accidents, and stroke. ACES LA was launched in 2020 as an effort to improve health of our DHS patients by identifying and responding to trauma with the goal of minimizing its impact on health. Implementation involved several steps. First, we embedded the ACE screening tool in ORCID to help providers have easy access to the screen. We then helped providers, everyone from the front desk staff to nurses to social workers to medical providers, get training in ACEs and trauma-informed care. This included participation in the state's online Becoming ACEs Aware training and multiple webinars and on-site trainings to help staff feel comfortable with screening and responding in clinics. We also work to streamline referrals to specialists, such as behavioral and developmental providers, social work, and health-related social service resources in our community. One Degree, our online referral platform, was a key part of this process. We also worked to expand several programs across DHS to support the needs of patients experiencing toxic stress, including the Resilience Bridge program at Harbor and the Strong, Healthy, and Resilient Kids, or SHARK program at Rancho. These efforts have led to a robust implementation across many DHS sites shown on this map, with more to come. As of today, nearly 800 staff have been trained, 15 clinics are screening, and nearly 40,000 screens have been completed. At $29 per screen, that's a lot of revenue that could be used to support our patients. As the program has grown, we have partnered across LA County to support patients and families in responding to ACEs and toxic stress. Many are shown on this slide. One Degree has been a mechanism for making these referrals. As many of you know, One Degree is available to all of our providers and staff and is open access for any patient. One Degree has facilitated more than 1,400 referrals across LA County. The DHS Shark and Financial Fitness's Resilience Bridge programs have also provided support for more than 500 patients and their families. ACE screening has helped us to identify need, and we are beginning to refer more appropriately. For example, screening leads to more social work referrals for children and adults on the date of screening, and more referrals occur when the score is higher. While there are certainly concerns that more screening could overwhelm our social workers, we also know that not asking doesn't mean our patients don't need support. It is our hope that the layered approach to response, through provider education, online referrals through OneDegree, and internal referrals to social work or other specialty services like Shark or the Resilience Bridge, will optimize patients' ability to respond to toxic stress. I've shared a lot in a short time, and I know this is a challenging topic. I want to thank you so much for your engagement and share some information in case you want to learn more. Here's my contact, and the ACES LA website can get you more information on other DHS programs. You can also get trained on the state website. It's a free 2-hour continuing education accredited course. Thanks again for listening.